Actimmune Injection is a prescription medication containing interferon gamma-1b as active ingredient. Interferon gamma-1b is a recombinant cytokine that mimics the naturally occurring interferon gamma produced by the immune system. Actimmune is indicated for the treatment of chronic granulomatous disease and severe malignant osteopetrosis. Indications. Actimmune is indicated for reducing the frequency and severity of serious infections in patients with CJD, a genetic disorder characterized by recurrent bacterial and fungal infections due to defective phagocyte function. Actimmune is indicated for the treatment of SMA, a rare genetic disorder characterized by abnormal bone growth and density, leading to skeletal abnormalities and hematologic abnormalities. How to use. Actimmune injection is administered subcutaneously using a sterile needle and syringe. The injection site should be rotated to minimize injection site reactions. Actimmune should not be administered intravenously. The recommended dosage of Actimmune varies based on the patient's weight and age. For CJD, the usual dose is 50 micrograms per square meter administered subcutaneously 3 times per week. For SMA, the recommended dose is 50 micrograms per kilogram administered subcutaneously 3 times per week. Dosage adjustments may be necessary based on clinical response and tolerability. Contraindications. Actimmune injection is contraindicated in individuals with hypersensitivity or allergy to interferon gamma-1b or any components of the formulation, severe hepatic or renal impairment, history of autoimmune disorders or severe psychiatric disorders. Special instructions. Patients receiving Actimmune therapy should undergo regular monitoring of liver function tests, complete blood counts, and renal function tests. Baseline assessments should be performed before initiating treatment, and monitoring should continue throughout the course of therapy. Actimmune may cause immunosuppression and increase the risk of infections. Patients should be monitored for signs and symptoms of infection during treatment. Patients may experience injection site reactions such as pain, erythema, and swelling. These reactions are usually mild and transient. Side effects. Common side effects of Actimmune injection may include fever, fatigue, headache, nausea, injection site reactions, neutropenia. Serious side effects such as hepatotoxicity, hypersensitivity reactions, and exacerbation of autoimmune disorders are rare but can occur. Patients should seek medical attention if they experience any unexpected or severe side effects.